Camille Robinson.
I'm Chinemerem and Nwosu.
We're both third-year medical students at Duke University School of Medicine. We're AC Reed Fellows and the co-founders of the Black Maternal Health Equity Initiative.
In the United States, Black women are 3 to 4 times more likely to die from pregnancy-related complications compared to other races.
And this is why we wanted to create our program. It's a student-led initiative at our medical school with the purpose of combating racial disparities in maternal health. The overall goal of our program is to improve Black maternal health through social support and advocacy.
In order to do this, we connect medical students with Black patients who receive care at the Duke High Risk Clinic. Patients and students form a longitudinal relationship, and the students help the patients, connecting them to resources, serving as an advocate and liaison between them and the medical system.
When I think about my patient and I's relationship, it's one that's near and dear to my heart. We met and became close quickly after some unforeseen circumstances led to her having a preterm delivery. So through some long days at the hospital and trips to the NICU to see her baby, she's shared a lot about her life with me. I feel honored to be a part of her journey, and I think, hearing and learning about everything that she's been through, I can also see how systemic racism doesn't discriminate and can dim even the brightest of lights.
Through this program, I've been able to learn a lot of information about the resources that are available in Durham and learn about how to support patients as they're preparing for a delivery.
Finding this program was really meaningful for me because just having that contact with a patient, teaching them how to advocate for themselves and advocating on their behalf, finding resources for them, and just being there for them when they're stressed and just need someone to talk to has been a really amazing feeling.
And I think that this was such a meaningful experience for me from sort of start to finish. Being able to be in my patient's C-section with her, to sit at the head of the OR table, to hold her hand during a really traumatic, unexpectedly scary delivery was probably the most meaningful experience I've had in medical school thus far.
I wanted to start this program because I was really tired of seeing social media posts, blog posts, news articles about another Black woman dying during pregnancy or in the postpartum period. That was something that affected me deeply, and I wanted to do something about it. I wanted to be able to give Black women advocacy and support when traditionally that wasn't a thing. Black women, in my opinion, deserve to have equal health care, equal opportunities at success for providing for their children and being as healthy as possible. And I really think that our program made a small dent in a really big problem, and I'm super excited to see where it continues to grow.
So this program is particularly important to me as a Black woman. I wanted to be able to support my community. Knowing that Black women have been historically marginalized and disadvantaged in the healthcare system compelled me to want to do something about it. And I wanted to be able to support them throughout their pregnancy. With my patient, it's just been great forming that relationship with her, seeing her kind of evolve throughout her pregnancy, and then also just hearing about her concerns. A lot of them that have been dismissed in the healthcare system. It was very important for me to be able to, not necessarily be her voice, but to amplify her voice. And that's essentially the role of a student advocate, and I'm very proud of the impact that we've been able to make.
Since we founded our program, we've had a significant impact in our community. We've paired a total of 11 patients with 11 student advocates and have had 8 seminars that tackle subjects such as breastfeeding in Black mothers, Black maternal mental health, as well as racial disparities in the field of obstetrics and gynecology. We've also delivered a total of 11 maternal health kits, which include baby clothes, baby diapers, bottles, and all the necessities for a newborn.
Additionally, we've been able to connect some of our patients to community resources such as doula services, food banks, and diaper drives. Collectively, our 11 student advocates have been able to attend over 60 prenatal appointments and 4 deliveries. We are very proud of the impact we've been able to make in this community.